Hi, today I will present about metabolic disease or disorder. This is my team, myself, Andrew Selingau anak Jelani, Nur Aimi Syahira binti Wadli, Sepian Alan anak Bicong, Siti Ruhayu binti Saleh, and Muhammad Haziq bin Awang Nazran. Okay, for introduction, metabolism is the set of chemical reaction in the body that convert nutrients into energy and building block for growth, repair, and maintenance. It involves two process. First one is catabolism, breaking down molecule to release energy. Second one is anabolism, building complex molecule using energy. Metabolic disease or disorder occur when these processes are disturbed, leading to energy imbalance or build-up of toxic substances. They can be inborn error of metabolism, example MSUD, PKU. Second one is acute metabolic disorder, example type 2 diabetes. This report reviews selected metabolic disease by exploring their cause, symptom, prevention, and related health information. Okay, this is our selected disease name. First is maple syrup urine disease. Second one is galactosemia. Uh, Third is phenylketonuria. Uh, Next is hyperthyroidism. The last one is diabetic mellitus. Okay, I will continue with maple syrup urine disease or MSUD. MSUD is a rare autosomal recessive metabolic disorder caused by a defect in the brain chain alpha keto acid dehydrogenase enzyme complex. This enzyme normally breaks down the brain's chain amino acid, leucine, isoleucine, and valine. The type of MSUD is first is classic. It is several onset within day after birth, minimal enzyme activity. The next type is intermediate, intermittent, and thiamine responsive. Milder form with later onset or partial enzyme function. Okay, I'll continue with cause and inheritance. It's caused by mutation in genes such as BCKDHA, BCKDHB, DBT, and sometimes DLD. Okay, both parents must be carrier. Each child has a 25% chance of having MSUD. Okay, for symptom, newborn often show poor feeding, lethargy, vomiting, irritability, high pitch cry, muscle tone abnormality, and signature sweet or maple syrup odor in urine, sweat, and earwax. Without treatment, seizure, coma, brain damage, developmental delay, and potentially death within months. For diagnosis, detect via newborn screening, hair prick blood spot test in many countries, confirm with blood amino acid analysis and genetic testing. For treatment and management, lifelong low protein diet restricting leucine, isoleucine, and valine, often supplemental with amino acid specific formula. And then for regular blood test and metabolic monitoring, special emergency diet during illness or stress to prevent metabolic crisis. In severe case, hemodialysis or liver transplant may be done. Transplant can normalize diet but involving lifelong immunosuppression. Okay, that's all from me. I will pass to the next presenter. Thank you.
Assalamualaikum and hi, my name is Nur Amy Shahira. I would like to present about galactosemia. Definition: galactosemia is rare inherited metabolic disorder. It affects the body's ability to metabolize galactose, a sugar found in lactose, caused by enzyme deficiency, especially GALT. Without treatment, galactose will up and becomes toxic. What is galactosemia? From galactose, plus emia, sugar in blood, caused by enzyme deficiency GALT, GALK, or GALE. Classic galactosemia type 1 is the most severe form and lead to organ damage without treatment. Types of galactosemia. Type 1 classic GLT deficiency, type 2 GALK deficiency cause cataract, and type 3 GLE deficiency varies in severity. Cause of galactosemia: genetic mutation, autosomal recessive, inherited from both parents, affect enzyme and lead to toxic buildup of galactose in blood and organ. Sign and symptom: disease of galactosemia. In newborn, vomiting, jaundice, diarrhea, poor feeding, lethargy, failure to thrive. And for complication, galactosemia is enlarged liver, cataract, sepsis, and developmental delay. Treatment of galactosemia: strict galactose-free diet for life, avoid milk, dairy, and food with lactose, soy-based or lactose-free formulas for babies, regular monitoring blood tests and liver function. Support and monitoring: speech and developmental therapy, hormone therapy for female if ovarian failure, genetic counseling for families, and lifelong follow-up care. Prevention of galactosemia: newborn screening program, prenatal genetic testing, educate parents and caregivers, and read food label for hidden galactose and lactose. Thank you. I will pass to the next presenter.
Hello everybody. My name is Saprinalan Anak Michong. Today I will explain about the rare genetic disease called phenylketonuria or PKU. PKU is a metabolic disorder caused by a mutation in a gene called PAH, which is found in chromosome 12. Okay. It is impair the body ability to convert the amino acid phenylalanine into a tyrosine. The simple way I explain about this is these genes have make an enzyme that break down an amino acid that we call phenylalanines, which come from our protein in food lah. So if the person has PKU, their body cannot break down the phenylalanines, so it will build up in the blood and brain. So if not treated, this can cause a serious brain damage and intellectual disability lah. And then PKU is inherited from both parents, so the person can get this PKU disease from their parents, who is carry that 40 genes lah. Okay. I will continue into the cause and symptom of this disease lah. Okay, the cause of PKU is the mutation in the PAH genes, which make the enzyme not work properly. Without the enzyme, phenylalanine become toxic and start affect the brain. The symptom is include the intellectually disability, and then the seizure, and then the delay development, the skin problem like eczema. If the woman with PKU is not treated during pregnant, the baby may have a heart problem and small head, with a low intellectual lah. So next I will continue with the treatment and prevention. There is no cure. There is no permanent cure for this disease, but it can be managed very well in early care lah, for the early care. So the main treatment for this disease is uh, the strict diet with a low phenylalanines. This means avoid from eat meal, eggs, meal, soy, and nut. And then some patient get a special medicine from take take a special medicine that we call seropterin or Kuvan for a mid case, and then Pevariasis for adult, and then regular blood test and mental health also very important lah. So they need to regular monitoring lah. Okay, for prevention, the new babies test for PKU within the first 2 or 3 days after birth, uh, and then also genetic counseling for the risk couple. This is so helpful for them who carry these genes. So in conclusion, PKU is a serious condition, but with early detection and proper care, people with PKU can live healthy and normal life. Thank you for your listening.
Hi, I'm Siti Rahayu. For our next metabolic disease, I'll continue with hyperthyroidism. What is hyperthyroidism? It is a condition where the thyroid gland becomes overreactive and produces too much thyroid hormone. This causes the body's functions like heartbeat, digestion, and metabolism to speed up. The two main hormones involved are T3 or triiodothyronine or T4 also known as thyroxine. These hormones help regulate how our body uses energy. The most common causes of hyperthyroidism is Graves' disease, which is an autoimmune disorder where the body's immune system mistakenly attacks the thyroid, making it produce more hormones than needed. There are several causes of hyperthyroidism. The most common one is Graves' disease. Other causes include thyroid nodules, which are growths on the thyroid, thyroiditis or inflammation of the thyroid, consuming too much iodine, and the overuse of thyroid medication. Some common signs and symptoms of hyperthyroidism are a fast heartbeat, weight loss despite normal or increased appetite, shaking hands, excessive sweating, feeling anxious or easily irritated, trouble sleeping, and a visibly enlarged neck, known as a goiter. If not managed properly, hyperthyroidism can lead to other related problems such as hypothyroidism, which may happen after a treatment, heart problems due to the strain from a fast heartbeat, osteoporosis or weak bones, and thyroid eye disease, especially in people with Graves' disease. Hypothyroidism can be managed with several treatment options, depending on the cause and severity. The first option is anti-thyroid medication. This, like methimazole, which helps reduce the production of thyroid hormones. Another common treatment is radioactive iodine therapy, which shrinks the overreactive thyroid gland. Beta blockers may also be given, not to treat the hormone levels, but to reduce symptoms like fast heartbeat and anxiety. In some cases, thyroid surgery may be recommended to remove part or all of the gland. To help prevent or reduce the risk of hyperthyroidism, go for regular checkups, especially if you have a family history. Avoid excessive iodine intake, including in supplements or certain foods. Manage stress, since it can trigger or worsen symptoms, and try to limit exposure to environmental pollution, which may affect thyroid health. With early detection and proper care, hyperthyroidism can be effectively managed. Thank you. I'll pass to my next colleague.
Assalamualaikum and a very good day to Miss Salfarina. My name is Muhammad Haziq bin Awang Nasran. Today I will talk about type 2 diabetes mellitus as it is one of the example in the metabolic disease or disorder. This type 2 diabetes mellitus is well known as a short-term T2DM. At the same time, it is one of the metabolic disease characterized by the hyperglycemia conditions occur in the human body. This condition occur due to the factor of insulin resistance and the dysfunctions of pancreatic cells in the human body, as well as it is underlying biochemical mechanisms that disrupts the regulations of the normal glucose metabolism. Next, moving forward to the cause, symptoms, and sign of type 2 diabetes mellitus. Cause of type 2 diabetes mellitus can be seen clearly through these four factors, including unhealthy lifestyle, genetic factors, insulin resistance, and the progressive beta cell dysfunctions. While the symptom and sign, this type 2 diabetes mellitus can be seen through these symptoms, including polyuria, polydipsia, polyphagia, persistent fatigue, blurred visions, and delay wound healing. Next is treatment and preventions of type 2 diabetes mellitus. In terms of treatment, there are several approaches that can be used to treat diabetic patients, including lifestyle interventions, pharmacological therapy, monitoring and targets, as well as the comorbidity management. In terms of prevention strategies, our main focus on the high-risk individual by implementing the lifestyle modifications and risk-based screening. Type 2 diabetes mellitus is a chronic disease affecting the individual in the rest of their life, as it is uncured and has possibility inherent down the generation of high-risk populations. However, there are several factors that reverse the type 2 diabetes mellitus, such as very low calorie diets, consumptions, and intensive lifestyle intervention for type 2 diabetes mellitus remission. As the conclusion, our group have been discussed and focused on 5 selected metabolic disorder or disease. In terms of MSUD, galactosemia, PKU, hyperthyroidism, and type 2 diabetes mellitus. In MSUD, it requires a low protein diet, newborn screening, and sometimes liver transplant. Next, galactosemia is life-threatening if untreated, but it is manageable by a strict galactose-free diet, as well as PKU benefits from lifelong diet therapy and genetic counseling. Then hyperthyroidism is linked to Graves' disease, and it is must treated with proper medication, surgery, or radioactive iodine. Lastly, type 2 diabetes is preventable and manageable through lifestyle changes, early detection, and public health efforts. Therefore, the public awareness, genetic counseling, and early screening are crucial to improving quality of life and preventing complication. At the same time, early diagnosis, dietary management, and ongoing treatment are the key to improving patient outcome. That's all from our group. Thank you.